Board of Health come to order. Do we have any comment from the public online or here in the office or here on site with us? Yes, please. Yes, sir.
Good morning.
Morning, Jeff.
Good morning, Chairman of the Board and board members. My name is Jeff Kettleston. I live at 489 South 44th Street in Billings. The reason why I came before you today is to talk about a Mend Park. Mend Park is a park that's located here in Billings that has multiple soccer fields, and I also believe that it has leagues of children that play there on a regular basis. I recently attended the South Suburban Urban Renewal District board meeting where they approved $675,000 contract to install high intensity outdoor UV grow lights. This proposal was accepted at the urban board renewal meeting. It went before our city council. Our city council has approved the installation of these outdoor grow lights. I've never heard of such a thing. The only thing that I've ever heard about is indoor grow lights for like a marijuana facility. So I did some very small Google searching, and for what I found out about these high intensity outdoor grow lights, that with exposure to them, there's a high possibility of blindness. There's a high possibility of skin cancers. And if OSHA actually is involved with these things. So I'm sure that the proposal may be to grow grass because we don't have enough sun here. I'm not sure about that, but I think that because it's a public park, public goes to it, especially because children are there, that perhaps that this issue falls into the wheelhouse of protecting the public, especially the children. So I would encourage our public board and whoever else to really please look into this issue, so we don't have to see in the newspaper or hear about somebody that gets cancer because of these things. So thank you very much. Have a great day.
Jeff, before you sit down, let me give you some background on RiverStone. We have three partners, three member corporations, and they are the cities of Billings and Laurel and the Yellowstone County. We are a public health entity. In the 90s, they came to the conclusion that they could better administer public health through a common entity instead of three separate ones. So we are involved with water safety, air safety, what else? Those kinds of things. We are not a research institution of any kind. We don't investigate disease or different practices. We rely on those research institutions to give us that information. So if you're aware of anyone who has the information that would refer to these outdoor grow lights and the risk to the public, we would welcome seeing it. We don't do that kind of work. We receive it.
Okay.
Okay.
I didn't know. I suppose I'll go to the library and see if I can find some information that would be beneficial to the board. Thank you.
Thanks. Any other comment for the board this morning from the public? Hearing none, can I get approval of last month's minutes?
So moved.
Second.
All in favor?
Aye.
Opposed? They're accepted. John, your report, please.
All right, good morning, all. First things on the health report this morning. A couple weeks ago, had some previously planned travel to Washington, D.C., which got upended by a last minute request from the American Association of Teaching Health Centers. to come earlier than I had previously planned. And so we hopped on a plane on a Sunday night and landed on a Monday morning and went right to HHS in Washington to meet with the HRSA administrator, Tom Engels, chief of staff for HHS, as well as associate administrator for the Bureau of Primary Care, Dr. Candace Chen. And we were invited as one of 4 teaching health centers across the country. One in my old stomping grounds of Scranton, Pennsylvania, one from Alabama, ourselves, and another one from Washington State. And had the opportunity to sit down with the HRSA administrator, talk all things teaching health centers, what's getting in our ways, what's working well. Thank them for pushing for 4 years of more sustainable funding than we've had in the past. And it was just a good opportunity to put faces and names together and be at HHS. We then spent the rest of the day walking through the Capitol building and the offices on the House and the Senate, glad handing, thanking the members of the committees who helped the expanded funding for teaching health centers and talking to them about how it would benefit our programs. Then I had a free day in DC, so I didn't make it to the Smithsonian, but I did go up to the National Association of Community Health Centers offices and met with their leadership team. A couple of their folks, their chief operating officer was in town, and just had the opportunity to talk to our member organization that represents community health centers and meet the staff there. So that's good. And then Wednesday, I finally attended the meeting that I was supposed to be there for, and was invited to a meeting on health and public health and outdoor recreation, and trying to create a new movement within the outdoor industry. I think RVs, boats, camping, fishing, retailers, clothing, Patagonia, all of those things, sitting around a table and talking about, well, what does America's outdoor era look like, and how can it help advance making America healthy and prevention. And so we talked about keeping kids off screens. We talked about getting kids outside and creating opportunities for both youth and adults to get outdoors. We live in a beautiful place here in Montana, and so we have a benefit of getting outside and doing things in the mountains or on the streams or out on the ranches better than others who live in more urban settings. And so it was a good opportunity to share what we've done historically as public health department, whether it was prescriptions for parks and trails, our gardeners market, other opportunities where we educate kids and adults on prevention and provide some outdoor opportunities. So great book there for all the readers in the room. It's called Last Child in the Woods. Richard Liu was the award recipient in the room. Former Montana Governor Steve Bullock was there. He is doing work on youth and outdoor education. Secretary of the Interior Doug Burgum joined us, and his wife was there. She actually is, I did not know this, special advisor to the White House for substance use and addiction. And she shared her personal story of recovery and addiction and recovery. And someone that I had actually met a couple of years ago on a city tour with the Billings Chamber of Commerce. We went to Grand Rapids, Michigan, and Stacy Baer is their director of Parks and Recreation. He's a veteran, and he shared his story of addiction and recovery. And what finding purpose in the outdoors meant to him. And so it was a good opportunity to hear those stories and make some connections. And then Toby O'Rourke, CEO of KOA here in Billings, was also there in attendance, and she and I are committed to working together to create some more local opportunities and build this bridge. So we're going to do some innovative things, I think, and some new things to help kids and adults experience the great outdoors and tie it to better public health and healthcare outcomes. More to come. Speaking of public health conferences, we had the Public Health Alliance conference here in town not too long ago. And I finally got some of the photos back from a national photographer, John Nolter. He was in town to help share public health stories. And so several of our staff are pictured here kind of sharing their why about, why their work in public health makes a difference and matters to them. And so that was a great opportunity. They interviewed public health professionals from all across the state who were there in attendance and have created a photo book of all of those quotes. Then our resident beekeeper, health officer, CEO, shared a lunch and learn with staff. The garden committee asked me if I would talk to the garden committee and any staff that were interested in beekeeping. And so I brought in some of my equipment. We talked about bees. We talked about benefits to the garden and talked about some of the public health and even behavioral health implications of beekeeping. One of the things I got to be involved in when I was back east was a veteran beekeeping project that worked to decrease post-traumatic stress and traumatic brain injury impacts with groups of veterans. Get them out, get them beekeeping, get them focused on something else, and give them a place to just disconnect from their struggles. And so we shared some of those opportunities and the public health connections between bees and what we do. And then I wanted to highlight as a mission moment a pipeline success story that we had recently. Our Eastern Area Health Education Center has been around for a while, but the latest win is a pipeline story. From someone who attended West High and a Billings local, she will now, as a fourth-year medical student, be coming back to RiverStone and doing her sub-I rotation here in Billings. So she's a WWAMI student. She fell in love with healthcare during Med Careers program that our very own Nicole Bacco puts on through AHEC, and got some hands-on experience volunteering and working closely with our hospice team while she was in high school, and has now come full circle to complete her sub-I rotation. Hopefully, someday we're able to complete the trifecta and get her into MFMR and interested in family medicine, but time will tell. And we're going to continue that work. We're starting to look with BLI, Department of Labor and Industry, on how we bring apprenticeships to RiverStoneHealth and expand our training capacity. The state, through not just through the Rural Health Transformation Program, but as a mission of Commissioner Swanson, her goal is to increase the number of healthcare apprenticeships that are offered in the state. Right now, they are few and far between. And so we are thinking of how we expand our MA training program that we were already in the middle of building and create some apprenticeship pathways, because there are financial incentives for the trainees, there are financial incentives for the organization to be able to strengthen how we train and teach the next generation of healthcare professionals. So more to come there. Then, as part of our ongoing partnership with United Way, our Warden Clinic was chosen to host a new rural little free library. And so it'll continue to get books into the hands of our patients, even our kids. We already have our RiverStone Reads program, which provides books to all pediatric patients as they come in the door or leave their appointment. This will just be one more opportunity to have books on campus and improve literacy. We already have a little free library here on campus, right outside by our garden, if you both walk down that way. The Campus Navigator program continues to expand. If you see folks on campus wearing a bright yellow lanyard, those are our campus navigators. They're identifiable. They're in plain clothes. They're not security guards, so to speak, but they're there to offer de-escalation for patients and staff should anyone need it, but also real-time navigation across campus, able to walk folks around, take you where you need to be, and then just check in on folks. We've got a lot of folks that come use our campus to charge their cell phone, to use the restroom, to have a place outside of the heat or the cold. And so they're there to help anybody that's here on campus in need find the right resource.
Are they indoor and outdoor?
Yes. They do roving patrols and walk around campus, and they will be the first to tell you that since the removal of the colonial buildings, foot traffic and the problems have decreased dramatically.
The last month's board meeting, I had the opportunity to do their activity in person de-escalation on campus. It was prompt, efficient. It's good. They took care of a potential brawl in the parking lot.
Awesome. Yes.
Have them around.
And are those regular employees that have additional duties or?
They are specifically hired employees to be campus navigators. Yes. And all three of them now have law enforcement background. So John Jones is our campus safety manager and security manager. And so he's in charge of that team. He comes to us from the Yellowstone County Sheriff's Office several years ago. Others have worked in the women's prison, I believe, and other facilities across town. So kudos to John Jones and to Bob for bringing that to fruition. Part of our continued success and sustainability as an organization is because of our people, obviously, are the people who are on the front lines doing the work every single day, whether they're out there de-escalating things or they're providing direct patient care. And so our culture is vitally important to making sure that we stay a great place to work and make a difference. So today, this afternoon, we're having our summer barbecue, part of our employee appreciation committee's work. Everybody around the table here, all board members, you're invited. If you want to come back to campus around 11:30, stop by for lunch. Fuddruckers is grilling. They usually have leftovers, so come take some. And if they charge us more, I told them they could take it out of my paycheck. But we'd love to have you there. Love to have board members there to just talk certainly with staff and thank them for what they do and show support. So if you're available and around, please stop by us. On a less positive note related to people and culture, our chief people officer candidate had signed a temporary offer letter to join us on May 18th. Which has obviously come and gone, and she will no longer be joining us. She will be moving to Virginia this summer, moving back east with family. And so in lieu of hiring a chief people officer, we have taken that role and instead now created 2 support positions within our human resources department. And so we will have a lead recruiter who will really be responsible for talent acquisition, along with a recruiter to help with that, as well as an FTE for payroll and benefits. And then the third FTE within that will kind of be a part-time compliance paralegal that will help Amy Mosier and our compliance team work better together. And so instead of the senior role, we need the doers. We needed to build the infrastructure out within HR. And so we've turned the unfortunate news into a positive by building a stronger HR team.
How do we ensure that within that group, at least one of the persons has expertise in human resources? I mean, true expertise in that discipline.
Yep.
And understands the legal ramifications and how to deal with.
Yep, absolutely. So we have some good bench depth in HR that has been growing. So our HR manager currently has been night and day, Michael. I kudos to Krista for coming along, and she still has lots to learn, like we all do. But is SHRM certified, is continuing her education in SHRM, getting those things. And under the previous HR department, he was never able to blossom and grow. And so we have a high potential employee that is continuing to grow. We have a recruiter who knows recruitment in and out, as well as all of the legal ramifications therein. And then we have a compliance system and a legal staff in our Montana Health Law partners now, in Stuart and Katie, that continue to help us, stay in the up and up.
Okay,
So
thank you.
I senior leadership, and I feel like we have a good process and system in place, and we're just going to strengthen that.
Okay, thank you.
Where does this report up then through the organization?
So right now, HR was always a direct report to me as CEO. We're going to shift that to better align, payroll, benefits, budgeting for FTEs, and these two leaders will report to Shannon and fiscal.
Did Shannon need more to do?
I was looking for something.
And I will say this is a trend. That's what we're finding at the county. If we have anybody that has potential, we better be working on them to come up through the ranks and take a senior position, because there are no senior leaders out there that anybody can afford. The market has become that tight. HR, accounting, you name it, across the board.
It's a tough marketplace. And I will say I'm getting closer to launch. Just a real quick foundation update for Board of Health folks and foundation board folks who are here. We're as close to launch on a newer updated structure, which will have either, I don't know what the title is going to be, but a director level position, with the opportunity to roll grants, potentially volunteers and events and community outreach into a better structure for the foundation. And I had an amazing call yesterday with a high potential candidate. Had one a month or so ago with another. And so we're trying to build some momentum to re-energize the foundation work. So I'll get an update out to the foundation board as soon as I can, get that position posted as soon as I can, and try to take that in a new direction. That'll be better for us. A couple other updates that weren't on my report. They just came out yesterday. Oh gosh, what are they called? Anyway, the state issued the state issued a 275 page environmental assessment on the proposed new forensic mental health facility in Laurel, and they will be holding a public hearing for comment on the proposal as well as other things on June 2nd. And so save the date for June 2nd from 1 p.m. to 3 p.m. at the Billings Hotel and Convention Center. Their representatives from the state will be to accept public comment on all things related to the forensic facility. So that is out there. I will send the link to Carrie so that she can put it in the minutes and share with the board. Obviously, I can't, it's too big to send. It's a lot of pages, but the information's there, and it's the most information that we've gotten on the facility.
The only,
The only information we've gotten on the facility up to this point. And so it is what it is. So I'll share that, and you can make plans to attend the public hearing and use that vessel to discuss that facility further.
and so board members, you may remember that John facilitated a gap analysis early on. We did that back, last September,
Yeah.
October-ish. And the state still has never answered that, and the EA doesn't answer any of those questions.
No. So we've continued, and we've continued to meet. We had another meeting at CLBI not too long ago to really refine how we approach our priorities of how we build a stronger behavioral health system across the continuum to decrease the need for forensic beds, to decrease the need for additional jail beds, to focus on prevention, to build out a stronger behavioral health system, crisis diversion process, all of those things. So the behavioral health team, the coalition continues to meet under the direction of Megan Gibson. They will continue to make progress and chip away at some of the gap analysis factors. For whatever reason, the state took offense that we were trying to improve the behavioral health system here in our region to support their facility that they were proposing. But we'll continue to do that work. We're working with some local legislators on legislative changes that will be needed to help support the system. And we'll continue to do that work, regardless of whatever comes of this facility over the next couple of years.
Does the report discuss the particular site?
It does.
Okay.
Discusses the site, provides the first schematics of the building. So definitely recommended reading. Parts of it, at least. Not all 275 pages unless you want to fall asleep later. But that'll be public hearing June 2nd. Next Friday is our annual golf tournament. We moved back to one day. Thanks to all the teams that were able to shift and adjust for us. But we're going to have a successful event. We have more flag prizes than we've ever had. We have more raffle prizes than we've ever had, and we just had a great outpouring of support for that. And so next Friday, 8 a.m. to 2 p.m. At the Laurel Golf Club. And if I have my way, and I'm an only child, so I always get my way. No, we will move out of Laurel next year. They have not been good to work with. And so we will move to Prior Creek, most likely, who is just salivating at the chance to have our tournament because one of the manager's wives, I believe, was on our hospice service. And he would love nothing more than to honor her memory by hosting our tournament next year and helping us. And so we're probably going to move venues to a much better location. That'll work for everybody. And then just last week, got called up to Helena to testify at the Economic Affairs Interim Committee. And we had a chance to chat about Kratom and provide some comment on why we did what we did and what we actually did here in Yellowstone County versus what industry and lobbyists think we did. They think we banned it, and we didn't. We just said, no, you're going to follow current Montana law, and it's not going to be allowed in food establishments. We're still waiting on the injunctive process to take place. County attorney has a lot of important issues to tackle. This is just one of them. And so we're working with Scott Fido and Steve to finally file that injunction so that these facilities know this isn't just the health department asking you. This is what the law says, and you cannot sell this if you're a licensed food establishment. So still waiting on that. But the good news was out of the Economic Affairs Committee, we helped write a bill with some public health folks to regulate more strongly regulate kratom and provide age restrictions, potency restrictions, testing, all of the things that you would do. That was much stronger than the industry bill that was presented last year. And then we also had presented a ban bill. And just get this stuff out of here. We don't need to deal with an opiate like this that's readily available at smoke shops, gas stations, and online. And we didn't think the ban bill would have any legs out of committee, but it did. And so out of committee now, we have two bills going forward, which will carry into session. And the one bill will be a strong regulatory bill, and the one bill will be an all-out ban. The strong regulatory bill will carry a fiscal note and price tag of about $1.1 million. And I have it on good authority that the speaker, the governors, and the majority won't pass any fiscal bills this session over $1 because of the deficit implications across the state. And so I'm feeling good about the ban bill, which won't cost us any money, essentially, and gets it out of the state. So couple different options on kratom moving forward with the state legislature. And then the other hot topic at the Economic Affairs Committee was AI licensure for AI medical providers. Not AI tools that a medical provider can use to help diagnose you, but instead of seeing your physician, look at your computer and have it diagnose you. The Cicero Institute is pushing this. They're the same group that has pushed AI prescribing in Utah, which is still miserable. And fortunately, there were some folks there from the state and a hell of a lot of skepticism across the committee on why in the world would we want to be doing this? And particularly, why would Montana want to go first? And so, as we've seen from the Utah pilot and other pilots across the country, every single state who has done something to be at the forefront of AI, either prescribing or medical treatment or delivery of care, has now backtracked and has reinforced human oversight of those tools and restricted autonomy. And the Cicero proposal would give blanket autonomy and licensing to a computer tool. So that's something we're going to be monitoring. I'm sure we'll talk about it at our public policy committee as we go into the session going forward. But I wanted you to know that was also out there in the ether. To wrap up here, I was accused of not having enough information in my report last month, so I want to make sure I have more this month. Flu season is officially ending. At the end of May, beginning of June is the end of flu season officially. We did see a spike in RSV cases across the state. And while it remained high, it's coming down. So the warmer weather is here. I had the upper respiratory crud after a week in Washington, and it just would not go away. And I know so many others around our community did too. So there was something out there. But flu is waning. And what I didn't have was hantavirus. I was interviewed last week on Voices of Montana at KGHL and talked about all of the summer health risks that we face in Montana. Hantavirus is one, but it's a small one. And it's not the hantavirus that we know from the cruise ship. That Andes strain of hantavirus is the only strain in the world that could even potentially pass the person. And it's caused by one single rodent in South America. So we don't have to worry about that here in Montana. Provided you with a lot of information on hantavirus and the hantavirus that we do need to potentially worry about here in Montana. But over the past 30 plus years, Montana's only had 46 reported cases of hantavirus. And it is a potential risk. It's a potential issue, but we know it well. It's not going to turn into some global pandemic, as some folks have said. We average less than 2 cases a year here in our state, and we know how to take care of it and treat it. So, provided you with some simple steps to prevent hantavirus. The 3 things you should remember are to seal up, trap up, and clean up. DPHHS put out some educational materials there, and you can take a look at those. Any questions? Before I end, I should also say we are closely monitoring the new Ebola strain and outbreak that is currently happening overseas on the African continent. And I just follow that closely because I had the opportunity to work on our federal government's response back in 2014 and develop a multi-tiered plan that we sent to the White House while I was at the VA back then. So it's just something that I always keep an eye on. Right now, we have nothing to worry about. We are containing it on the continent. And if anything changes, we'll share more information. Now, any questions?
One quick question. So the beekeeping project with veterans on the East Coast that you're involved with, is that something that can or should be established here?
Totally. Yeah, absolutely. And I think there might be some groups trying to do something. But I just haven't had enough free time to do that.
You've been putting together.
Yeah,
Report.
nice long report. Yeah. But no, there's a lot of peer-reviewed research out there on the benefits.
Love to see an organizational chart. I haven't seen an organizational chart in years. And with all of the changes, it might be helpful for all of us to see
Yes.
how that all goes. When it's appropriate, when some changes in the future. I don't know if you want to put that in there. Love to see how. So.
You got it.
Thanks.
Other questions for John? Hearing none. I don't see a report or Megan. Don't see a report in my package or Megan in the house.
I did send it late last week. You
You
have it, John.
I have it, yeah. I'll give some updates from the CMO's perspective for
And
sure.
I'll send it out.
Yeah. Yeah, we got it. Late breaking news. There, Joe. I went too far back. Yeah, I did. I had a chance to review it last night, and there are a couple things that I hadn't included in my report, so I'll bring that up. All right, as far as staffing and recruitment goes, we're pretty good on providers. Our advanced practice provider residency program, Shane McCullough, who's been a PA with us for a long time, has accepted the role of associate program director. We had a new returning PA came back to us from the world of urgent care, thought that the grass was greener on the other side, and decided to come back to RiverStone. So I'm glad to have him back. And then we've offered another PA role. So fairly good there. In behavioral health, we had some issues recruiting for our senior high, our senior high position as well as our career center position. But as we told the clinic board this month, we have that senior position or the career center position filled.
Career Center.
Yeah.
They're both filled.
They're both filled.
Most recently, the Career Center position was filled.
Awesome. So we've now had both positions filled, and so we'll be able to, one, continue behavioral health and senior, and then expand and open our new site at the Career Center with SD2. So that is a win. We continue to work in the residency. We've hit some bumps in the road with our scheduling software that they were implementing, and so we're working through those hiccups and continuing to expand our MA training program and get that fully developed along with potential apprenticeships. So continuing to work there. We are recruiting currently for a new dental resident. We're going to do that outside of the match again this year in the dental program. That's where we found Dr. Miranda, and so we're going to continue to hope we have good luck outside of the dental match and get a new dental resident here in Billings. And we are the only dental residency program in the state, and so we want to continue to have folks in that program. We did get some funding last month or month before. Thank you, Spencer, Yellowstone Bank, for providing us just over $42,000 through the Federal Home Loan Bank of Des Moines program. You might have seen other banks as well as Yellowstone get a bunch of money from that program this year. And so we're going to utilize that funding to move our Childhood Advocacy Center over to this building and get them reestablished in a better space.
Where is it current?
It's currently over in the wellness building on the second floor in kind of a piecemeal space that they've made the best of. But they'll be in the old human resources suite. And so they'll all be in the same spot, which will help improve services there. We're also going to be able to use those funds and the funds that we received from Cushing Terrell, their golf tournament proceeds, to update our recording and storage system for the CAC. Right now, we didn't have the best system in place, and this will allow us to have a nationally recognized system through our accrediting body and a better system more seamlessly with law enforcement and the judicial system. So that is good news. And I think that's everything that wasn't already stated.
Thank you. Any questions for John about the CMO report?
Do the school-based clinics stay open in the summertime when there is no school?
Eric?
Not the same hours, but yes.
Okay,
And I should say it kind of depends on the school. At Medicine Crow and Orchard, we have external entrances, and so they have a little more flexibility. So they're on a kind of a reduced schedule throughout the summer. At Senior, it's a little more limited because they really locked that building down because of some of the issues And so what we're doing is we're taking our mobile unit out there a day a month just to provide some continuity for people.
Okay.
Yeah.
Any other questions? Hearing none. Brent, let's talk public policy.
All right, let's talk public policy. Every 2 years, some months before the state legislative session, the Public Policy Committee develops and revamps what's called the Legislative Public Policy Agenda, the copy of the last year's, 2 years ago, one in your packet. And a little bit of history. Years ago, when Michael Dennis was on the committee, he was adamant about keeping it on one page. And because it started as kind of just a few bullet points and then developed, and Michael left that committee, and since then we kind of went wild. 2 full pages. So this year, at the last meeting, we discussed it. We decided perhaps we should condense it. And it's sort of a dedication to Michael. We are going to completely redo it. The staff is going to work on the first draft because it'll be very major change, try to get it down to one page. We use this during the legislative session. We give it to copies of the legislators, and we also keep in mind the items that we're particularly interested in working on at the legislature.
And it'll still be readable print.
Yeah.
Hopefully, yes,
Yeah.
right, yes. Over the years, we kept the one page by getting smaller and smaller. So it's just kind of a black smear on the front.
Thank you for doing that.
Yes, we'll probably have your name on it.
Memorial.
Kratom update, which we have every month. There's about 5 cases that are with the county attorney. Otherwise, the process is moving along.
Yep.
There's a local hotel that's had an experience with Legionnaire's disease off and on. The staff is working with that. And then in the past, we reported on a program to rate food service establishments and buildings. That's kind of been on the back burner, but that's going to go ahead now. I think the title is the Clean Plate Club. It's also called the Scores on Doors. It's a program that restaurants can receive ratings, and they can even post them, and like the 5-star type of restaurant type of thing. So that's something to look forward to seeing in the fall.
I will give you a brief update on the Legionella issue at the local hotel. They began remediation late last week. And so that remediation process can take up to 2 weeks to flush their entire water system. And so they're doing that with a contractor here in town who provides them with a specialized chemical to flush their system of any biofilm that could be in their water system, and then fully remediate that issue. And so we don't expect to see any additional cases out of that incident because the remediation process has begun and the overall risk is low. So I just wanted to update folks on that process.
Any questions for Brent? Comments? Hearing none, can I get a motion to accept the report?
So move. Oh, second.
All in favor?
Aye.
Opposed, same sign. It is accepted. Safety and quality, Dr. Tapia.
This month, we reviewed indication for hospice and home health. It's a specialized area where they do a lot of work outside its facility. And so they have a very structured, very extensive both onboarding, training, and then monitoring of skills and that sort of thing. They review their effectiveness. They have daily, quarterly, yearly. They have reviews. They have we use the Reliance system, which is our computer-based learning management system that helps to keep track of all of that. We have, in addition to training of the staff that's in that area, we also have the residents that they all rotate through the system so that they get at least some foundation on how home care and hospice works. We also take care of their emotional needs. For example, in hospice, they start their weekly meeting with a reading of the names of all the people that have died, well, not too many, but some, and give opportunities for the staff to share any information about those individuals. And also we use chaplains and our grief management people to help out there. So it was I think a fairly extensive review of what we do, and it's all very impressive, I think. Committee members, anything else?
It helped to hear the level of respectfulness that the providers in those, it's challenging work, it's difficult, but the level of respect that the providers give to the clients and their families, especially grieving families.
Mm-hmm.
And I think it's a strong and purposeful part of the education of those providers, and it was good to hear that.
They make use of something, and I don't remember exactly what this is, but the Tamarack Grief Response Center. Tell us a little bit more about that, or can anybody tell us a little bit more about that?
I can help with that.
Okay, good.
So the Tamarack Grief Support Center is, it's a organization that provides grief support to youth. And they do programming and camps on the western side of the state. And so in Montana, they're kind of a gold standard for that programming. And so a couple of our social workers and chaplains, I think 2 people, went and spent some time with them, learning about their programming, what they do, how they do it, how we could design something on the eastern side of the state that kind of fills a similar need over here. And they are working with them to kind of help build out that programming over here. We were recently able to hire an additional grief support person using some of our was it endowment money or donation money for the hospice program. And so we have a little bit of additional capacity now. So I think that's probably what they were alluding to.
Okay. Yeah. All right. Anything else? Okay, that's it.
Motion to accept the report.
So
Second.
All in favor?
Aye.
Opposed, same sign. It is accepted. We have a phone book worth of
So much,
material.
so much for Carrie.
Spencer is out of town this week with his family. So would you like to
Sure.
give
Yep.
us an update?
Yep, definitely. Just had a ton of financial information within the packet, as the finance committee did meet the board, the month before, excuse me. And so you'll see February financials included in there along with dashboards for RiverStone Health. And then for March financials, this is the quarter month end where we do combined financials as well as present the YHP financials. So we've got RiverStone, YHP, and then the combined RiverStone YHP financials and dashboards included in the packet, as well as our preliminary public health mill levy allocation. So I'll concentrate more on the March financial information versus February. I always say this gets to be a hard time of year to present financial information on the fiscal year as we start to budget for the fiscal year and everybody's moving into the next year. But I'll present on March for this meeting. And so if we talk just a little bit about the RiverStone Health financials, and if you're following along with those dashboards, I'll just highlight a few things related to the month of March. Cash totaled about 15.4 million, which was an increase, just to put it in perspective, of 2.8 million from March of last year. Of this balance, about 12.4 million is unrestricted. When we're looking at our days cash on hand metric that we've been following throughout the last fiscal year and even a little bit prior to that, we're at 78.07 days at the end of March. The previous month was at 73.83. Again, the board has given us a goal over this fiscal year and the next fiscal year to get to 94 days. In my head, that was 84 this fiscal year and then up to 94 next fiscal year. So I feel very confident that we'll get to that 84 days cash on hand by the end of June. Again, we will have an influx of cash in June with our second health levy payment. And so based on that and where we're at this point, I feel confident that we'll get to that 84 days cash on hand goal. When we're looking at the profit and loss for the month of March, we ended the month at about 384,000 versus a budget of about negative 12,000. Our patient services revenue was over a budget of about 186,000 for the month. If we're looking at this on a year-to-date perspective, we're under budget about 265,000 on patient services revenue. The biggest variance that has been within the financials all fiscal year relates to wages and benefits. We were under budget 127,000 in the month of March, but we're under budget $1.9 million year to date. So as we look at our bottom line year to date at $2.7 million positive bottom line, significantly impacted by that variance in wages and benefits throughout the fiscal year. We've obviously started our budget process for the next fiscal year, incorporating in what we have right now for current vacancies and staff, as well as looking at any potential new positions. And so as we start to draft our fiscal year 27 budget, we have about 4 FTEs within the budget that are either unfilled or new positions. And so I think we are tightening that up. We are getting staff hired, but it has taken a good chunk of the fiscal year, and so has created a lot of that variance for us for the month of through the month of March for the fiscal year. Nothing else really significant on the RiverStoneHealth side, but I do want to touch on a couple of YHP items as relate to those financials and the combined financials. Like I said, we do have to submit quarterly combined financials to the bond company. And the one thing that we're really monitoring on this has to do with the days cash on hand when we combine both of those entities. And so it's a little bit different calculation than our days cash on hand that we're monitoring for RiverStoneHealth. But it's an important metric for us organizationally and one that we'll have to report on in June. And so if we're looking at that right now, when we combine both of those entities together, we're at about 152 days cash on hand through March. Our debt covenant is at 60 days. So we'll be good when that comes to June and we have to report on that to our bond company. Just a couple of things to touch on the YHP side. Really nothing significantly going on in that entity. We haven't had a lot of fixed asset purchases or any sort of significant maintenance over the fiscal year. The only fixed asset purchases in the last quarter were about 32,000, and a lot of that related to some of the pre-demolition costs with the Colonial. We will see the Colonial on the books starting in the month of April. Everything is closed, and so we'll see that reflected on the YHP financials starting in the month of April. Important to note that we still do have those cash balances within YHP. We have the proceeds from the sale of the hospice house still earmarked in a dedicated account at Yellowstone Bank, and that was about $1.8 million at the end of March. So nothing else really significant going on from that entity. The biggest thing will be when we see the Colonial move into that. Any questions on those before I run through a quick budget update?
What's causing the 340B?
Yes. And so if you want to follow along within the packet on the dashboards, there's some really good information within the graph. And so it's on the RiverStoneHealth financial report on the third page of that. There's a 340B pharmacy, Medicare price negotiation, financial impact, a couple of graphs related to that. And so we've talked a little bit about this throughout the fiscal year, but we did see it obviously take place in January of this calendar year. And so as we're looking at that, what we're seeing is reimbursement on specific drugs being impacted. And we knew this ahead of budgeting and we were able to incorporate it in. But if you're following along with those graphs, you can really see the impact of that. And so essentially we see in December, we were getting reimbursement of about $138,000 for those drugs that were impacted by that price negotiation, When we get to March, that's down to $34,000. So a very, very significant decrease. And then the right-hand side of this shows it really isn't impacted by volume. We're seeing about the same volume of these scripts. It really just is that reimbursement. So we'll continue to see these drugs selected in each behavior, and we do know them. And so that part is good for us organizationally. And so as we look for our budget for next fiscal year, we've got those drugs earmarked, and that will be an impact of about $375,000 to us organizationally. So the good is that we can plan for it. The bad is it's very significant.
Thank you.
Yeah. Okay, budget update. So we did bring a draft budget to the finance committee to take a look at and review, and just to go through a couple of assumptions that we're using within the fiscal year 27 budget. Within our budget, the largest piece of that budget for us obviously is salary and benefits. That's what we always start building our budget around. Over the last, probably 3 or 4 months organizationally, we've taken a look at compensation across the organization. And what that involved essentially was a group across the organization sitting down and going through every single member of the organization, looking at resumes and looking at years of experience to get everything consistent across the organization. What that allowed us to do is really look at our wage tables and eliminate some unnecessary positions, kind of hone that in and get it to a more reasonable, I think we took it from 27 classifications down to 20, and just trying to get everybody in the more similar spots across the organization. And so essentially what we did is take that wage table with everybody's years of experience and work towards getting everybody to their pay based on years of experience. Now, it's not something that we're going to be able to do right away organizationally, but something that's very important to us throughout the organization. What that essentially means to us right now is we've got about $1.3 million of staff increases into the budget for fiscal year 27. As a reminder, we put about $1 million into last fiscal year, so a pretty significant investment for us organizationally into staff wages. It will take us, as what we're predicting is about 5 years to get everybody to the right place within those wage tables based on years of experience. But we've got a plan to do it. So that's great news for us organizationally. And so the recommendation for this next fiscal year is going to be similar to last fiscal year, where it won't be just a lump sum increase for staff across the board, but more individualized increases as it relates to the years of experience within those wage tables. So that will be combined increases within the next fiscal year budget of about 1.3 million. And then a couple other things that we're facing. I did touch on the 340B Medicare decreases. So that's about 375,000. And then the other thing that we're navigating for this next fiscal year's budget is the Medicaid payer mix shift. And essentially what we're estimating right now is a shift of about 5% of patients falling off of Medicaid and over to self-pay within the organization. And that ends up being an impact about 891,000. So those are the big assumptions that we're throwing into the budget. We have some work to do on that budget within the departments and within the managers. And so at the June meeting, I'll bring a proposed fiscal year 27 budget for review. However, the one thing in the packet that we do need to take a look at for this month is the public health mill levy breakdown. And essentially that's how we allocate our public health mill levy across the organization. This should be an easy one to look at because there's really no significant changes as it relates to last year. And so there's a graph within your pie chart showing the different divisions within public health and how that's allocated out. Really the only change in there is just a little bit of an increase into the health promotion, about $13,000. And the only reason that's an increase is we decreased the amount that we reserve for our protested property taxes. So we kept our health mill levy allocation budget stable with last fiscal year, just kind of based on preliminary information from the county and not being sure what we were going to see with increase based on property taxes. So we kept that stable and just decreased what we always set aside a little chunk for protested property taxes. So we just decreased that a little bit. And that's the only reason you'll see a small increase, a $13,000 increase into health promotion. Otherwise, we're recommending leaving that allocation the exact same as the previous fiscal year across those different public health areas.
Any questions for Shannon? The impact from 340B, is that the net between the revenue decrease and the expense
Yep.
decrease?
Yep.
Okay.
Expense increase.
Expense increase,
Yeah.
okay.
It's going both opposite ways than we'd like to see.
And the Medicaid shift is we're expecting people to lose
Yep.
eligibility.
Yep. Yeah, it's a guess at this point, but feel comfortable starting with the 5% shift within that across the organization.
Plus how Medicaid is being paid, it's shifting too, right?
Yes. Expect What's the,
We'll have a per member per month rate. Is this?
So for a certain number of patients, yeah.
Yeah.
We'll
And that-
still have the PPS rate for every
Yeah,
visit that we
yeah.
do, but on top of that, we're getting a PM rate for quality, clinical quality outcomes achievement.
okay, we've got,
Question.
Yep.
The money we got from the hospice home,
Mhm.
any limitations on how it's used?
That is why we set it aside in a separate bank account, just to earmark it for future, whatever was decided to do within that board. And so, like I mentioned, it's in a completely separate account, interest-bearing account at Yellowstone Bank, so we can keep those funds separated out and divided for future.
We'll determine how that money is spent.
Our foundation board.
Foundation.
That's held within those accounts. And I think the most important thing for everybody to message and continue to message is that taking down Colonial, buying that property, no public money, not the hospice money, all funding that RiverStone had within our own accounts in YHP. And so it's not going to be a parking lot. It's not going to be a car wash. It's going to be something that we will vision out in the future. Eric and I got to connect. We will be the recipient of a pro bono award from Cushing Terrell this cycle, and they will help us vision what a facility could look like on that corner. And so we'll be working with them shortly to just develop what the concept of the plan could be. So then we can begin talking about it, bring it to the foundation board, bring it to this board and say, this is the overall goal for what we want to do for this community.
I think we have pretty much decided that 1.8 million for sale hospice home would somehow be used for future hospice services. To sort of honor the people that make contributions to it, that it doesn't go to some other.
Well, that's what I wanted to be sure of.
Yeah. And I think we can do that. And then I also think we need to take everybody. There's a lot of mixed feelings on the foundation board, and there's a lot of mixed feelings in the community about the foundation. One's because we've just struck out on EDs over the last couple months and years. But two, we've got to take a victory lap because hospice is funded at RiverStoneHealth. The endowment is sustainable, the program is sustainable, and it is because of the work of the RiverStoneHealth Foundation and that board that hospice is sustainable. And so when we reconvene and come back together, we got to do a damn good job of patting ourselves on the back and celebrating the success and the accomplishment of the foundation, because there's been way too much boo-hoo, poo-poo sitting around talking about how we, raise philanthropic dollars. But that board and that entity has done a damn good job making sure that we're able to provide hospice to everybody in this community. And we're the only ones in this community that can continue to do that because we have that.
So this is on a different topic, but Pacific Source announced that they're leaving the market.
Yeah.
Do we have a lot of business, or is it fairly minimal business that Pacific Source
Yeah,
adds to RiverStone?
I don't have an exact percent. It's not going to be significant though. Obviously, our largest payer source is Medicaid. And then obviously we have a huge chunk of self-pay. So Blue Cross ends up being our most significant private insurance company. I don't have a specific on that, but I'll definitely check into that.
Yeah. Yeah. So that, that's going to leave a mark across the marketplace.
Well, they were on the exchange with individual
Yeah.
products.
Yeah.
They had a Medicare Advantage plan.
Yes, we'll watch that one. I think from a budgeting perspective, some of the changes from HR1, we're seeing impacts to our own health insurance program within the county, and other plans across the state. And some of the market stabilization that's happening due to HR1 has now driven, it's basically equalized high deductible plan costs and traditional plan costs. And so where there used to be a financial incentive potentially and a tax benefit to an employee taking on a high deductible plan and carrying an HSA and saving, now what we've seen is that the monthly premium costs are exactly the same for both plans. And so whatever incentive there is now gone. But it's having an interesting impact on us internally, right? As we plan to roll out benefits costs for the next year. But then across the region and the country, it's going to impact folks that have private insurance plans.
Carol, the articles I've seen, that specific source has about 30,000 enrollees across the entire state.
Yeah.
I don't think it's gonna be a big hit.
I wasn't surprised when I heard that they were leaving the market,
Yeah.
just because I know it's been a tough market for them.
Yeah. And the rumor on the street too with payers has been, Select Health is coming in to Montana. But I don't see the light at the end of that tunnel anytime soon. Particularly unless Intermountain picks up another big city or another big facility in the state. Because I don't think they can make the math work. Because it's a self-insured, they have to have their own facility to send folks to. So, yeah, it'd be interesting to watch the insurance market within Montana over the next few years.
Well, it's a difficult market because there aren't any people.
Yeah.
I mean,
Yeah.
you know.
Yeah.
I used to call it the law of large numbers,
Yeah.
and there are no large
There are no
numbers.
numbers. Yeah, that's from a value-based care perspective. That's the other piece we've been looking at is, where across the region and the state, how do you create a pool large enough to really take advantage of value-based care? And as the primary care association looks, well, do you partner with the Dakotas? Do you partner with the Wyoming? Do you build a bigger pool that way? What does that look like? So no easy answers.
That's why the school districts, the legislature passed the bill that if the school districts can come together and form a pool, they'll get money to do it.
Other comments or questions about the finance committee meeting report? Hearing none, can I get two separate motions? First one to accept the meeting notes and all of the reports and dashboards.
So moved.
Second.
All in favor?
Aye.
Opposed, same sign. They are accepted. Then can I get a motion to approve the mill levy allocation?
So move.
All in favor?
Aye.
Opposed, same sign.
Aye.
It is approved. Okay, governance committee met last month to cover a couple things. Want to talk about the kratom enforcement. Anything else to add?
No, that's where we are right now. We're just waiting on the wheels of justice to turn more slowly.
Okay. And we've drafted a more succinct, hopefully, public comment guideline, which the committee chair forgot to update and return to the committee to get final approval. So presented today, but he'll do that in the next month. We want to focus any pre-meeting comments on our agenda for the day. Is the gist of it. But it'll get to committee, be approved, I expect it will be approved and it'll come back here for approval with the full board next month. Any comments or questions about governance? Can I get a motion to accept the meeting notes?
So move.
Second.
All in favor, opposed, all in favor?
Same sign.
Thank you. It's approved, accepted. Any old business to come before the board? Any new business?
I'm anxious to see what this commotion is about, the grow lights stadium. I'd like to see some references.
I've been scouring city council agendas and actually asked our Melissa in public health is on the Parks Board.
Oh.
And so she's gonna do some finding out for us.
See what,
She thinks it's related to the community garden, which is at Amen Park. That they purchased grow lights for the community garden rather than the fields, but because the main field there is turf, nothing grows. So I'm interested in know more. Yeah, I think we've just got to get educated. It's something that's not on my radar.
I Googled it quickly. It doesn't appear to be a public danger unless you stare into the picture. For outdoor grow lights.
but I guess the point is, it's not likely not a danger which we can disseminate. to
Yeah,
the
I know,
community.
not definitive, but that's
The appropriate literature supports that. I mean, good science, so to speak, it supports the fact that it isn't a concern. And we can tell the community instead of dissemination of information that's not accurate and get the community all upset with something that's not.
That's why we just have to get educated on it. And, like the chair said, if we get some additional information from Jeff who can share it with us, and then we'll get information from the Parks Board and understand the what and the why and all of the things. Because right now we know zilch. So, yeah, so we'll find out the facts and then we'll see if it falls within our purview or it's a nothing burger.
Thank you.
Yep, thank you.
Anything else for the board this morning? We are adjourned.